Development. I'd like to welcome you today to our session that will present initial findings from a collaborative research endeavor between AEON Collective and Community Jameel. The research endeavor intends to scientifically evaluate the impact of climate change on health in the GCC. And to kick off our panel is a short introduction. From AEON Collective's co-founder, Princess Mashal Al-Sha'lan, and Mr. Fadi Jameel, Vice Chairman of Community Jameel. Please join me in welcoming them.
Well, first of all, thank you everyone for joining us. I'm not going to speak as a speech per se, it's more of a quest from the heart. I think the area of health is one that touches us all quite intimately. We've known this post-COVID. We've seen this and its impacts in our homes. And I think that part of humanizing the climate factor is to understand the health implications, ones that are specifically already being felt in our region. So Nawaf, if you could go to the next slide, please. So this is not really a slide. It's sort of a mix of raw data from one of the brilliant scientists that we have joining our effort in the publication that we'll be hopefully releasing in Q1 of 2022. Natalia has gathered data of historic climate change in our region from 1979 to date. As you can see, it's not been a pretty picture, and it's been getting progressively warmer and redder as the circle moves from this side to the other. Equally, we've seen the circles, the dark blues, have been sort of becoming less and less prominent in most of our cities, in most of our capitals. Reason being, and that essentially means that we've been losing a lot of our precipitation and with it rainfall. So this is something that is actually already impacting us today. I think this is part of the big push of why Saudi Arabia is being very serious around climate action, because it's not something that's abstract, it's something that we're already feeling in our cities, and it's already impacting us today. So without further ado, I'll give it a bit to Fadi to speak about the great work and collaboration that we'll be publishing next year, and then we'll move on to hear from our scientists. So Fadi.
Thank you very much. Distinguished guests, ladies and gentlemen, it is a privilege to be able to address you at this timely and important event at COP26 here in Glasgow. I would like to extend my gratitude to His Excellency Ahmed Al-Khatib and all the team at the Kingdom of Saudi Arabia Pavilion for hosting us all this afternoon. This past year, my family marked the 75th anniversary of our philanthropy, which includes Community Jameel, our organization for advancing science to help communities adapt to a rapidly changing world, changes that include the climate emergency. The GCC, like the rest of the world, is seeing the impact that climate change is having on people's health. When Community Jameel and AEON Collective decided to convene this research partnership, our objective was to bring together a consortium of world-leading researchers, scientists that could help to positively change the GCC's climate change and health policies. This partnership encapsulates the vital role organizations like ours can play in the fight against climate change. By enabling the scientific community to produce evidence-based and actionable recommendations, we can guide both the public and private sector in tackling our most pressing sustainability challenges. The researchers and speakers present today are producing a seminal report that will play a critical role in shaping our understanding and future response to climate and food insecurity in the GCC, with a focus on the most vulnerable groups in our society. They will shortly be sharing their reflections on the effects of climate change on public health in the GCC, as well as evidence-based insights into the policy and technology solution that will help mitigate future negative impacts. It's important to add that our work will not end there. This event forms part of a longer series of collaborations that will continue to advance our research on sustainability and public health in the GCC for years to come. I would like to sincerely thank all the experts that have contributed to the study for their dedication to this project, the team at AEON Collective for their collaboration and partnership, and all our distinguished guests in attendance for being here today. Thank you very much.
Thank you all for joining us again. I'd love to start perhaps with Professor ElFatih AlTahir. Professor ElFatih is a professor of hydrology and climate at MIT, but also serves as an advisor for Community Jameel. Professor ElFatih, if you may speak to us on two key areas, perhaps. The first is on the impacts of climate change on public health in the Gulf region from the heat wave perspectives to perhaps some vector-borne diseases, as well as implications specifically of climate on Hajj. Professor ElFatih, you have the floor.
Thank you very much, Cheryl, and thank you for inviting me to participate in this important panel. It has been a pleasure to participate in this study and sharing some of what we know with the rest of the group. So if you move the slides, I'm going to show like a few slides in preview of what I'm going to say, but I could go back in some more detail later. This first slide actually shows not model results, but observations. If you look at all observed heat indicators, and here the heat indicator we are using is called the wet bulb temperature. And the reason we pick that temperature is because this is the temperature that the skin of a human body would assume under well-ventilated conditions. And because of that, you could see it provide a direct link between climate and health, because it's right at the interface between the humans and the environment. The interesting thing in this map is the emergence of the Gulf region as a hotspot for heat stress. You see the darkest red is around the area of the Persian/Arabian Gulf. And usually people, when they look at maps of this type, the Gulf emerges as the main source of energy, the main source of oil. But here it's really presented on the impacts of climate change, and it showed that it's potentially one of the regions that could suffer from those impacts, together with a stretch of land that goes from the Gulf to eastern China. If you move to the next slide, the next slide shows a more detailed modeling and their different scenarios. The left is historical, the middle is mitigation, and the right is business as usual. And the top is the wet bulb temperature that I just described, and the bottom is the temperature, just the regular temperature. If we fix our attention to the right-hand side, we see how these projections show that areas around the Gulf would emerge with temperatures approaching or exceeding 35 degrees centigrade wet bulb temperature. These are deadly levels of heat stress that have not been observed in the current climate and potentially could happen in this region if we don't mitigate climate change. The bottom figure, also on the right, showed the maximum temperatures that will happen toward the end of the century, again under business as usual. And interestingly, you see Iraq and the area west of the Gulf emerges as potentially the hotspots. This is the dry regions with not much humidity. If you move to the next slide, then we see, and I'm trying to cover this in a short time, we see here the distribution of these temperatures, the statistical distribution that could happen in the future under business as usual for different cities around the Gulf. You see Dubai, Doha, Abu Dhabi, and if you focus only on the red line, you see that the tail of that would approach and exceed the 35 degrees centigrade. 35 degrees centigrade is assumed to be the threshold for survival of humans if you get exposed to it for 6 hours or longer. If you move to the next slide, the region here of around the Gulf is not only the cities on the Gulf itself, but this is the location for Hajj. Hajj occurs every year around Mecca in Saudi Arabia. So this is analysis of records of temperature in Mecca for the 20th century. And they show persistent increase if you look at wet bulb temperature or if you look at temperature. And that's increased is happening, whatever data set that you look at. It's shown on the right, the occurrence of temperature during the Hajj at different danger levels, from extreme danger to danger, extreme caution, according to the National Weather Service classification. And because Hajj rotates with a cycle of about 30 years, around 2005, the temperatures were low, and that because the Hajj was occurring during winter. And now, close to 2020, Hajj is occurring close to summer, and you see that is sampling quite extreme temperatures. If we project that into the future in the next slide, we could, in a study that we published a few years ago, we projected what kind of conditions would be experienced by people participating in Hajj under the mitigation scenario versus the business as usual scenario. Hajj is an event that occurs every year with a few million people participating in it. Muslims represent about a quarter of the world population now. Many of them, most of them aspire to perform Hajj once a year. And in that ritual, they will have to spend time outdoors for about 20 hours or so in a period of a few days. And so that's why the exposure to the environment could be a significant factor in determining the health of those pilgrims. So you see here, as time goes into the future, Hajj will occur with temperatures that are really going to be extremely dangerous for the people performing that ritual. So I would think I'm going to stop here. The other aspect that we looked at in this study is we looked at the potential for expansion of areas that are covered by vector-borne diseases, mainly diseases like dengue and Zika, which do not exist in the area around the Gulf now, but we raised the possibility that with climate change and the change in the distribution of the vector for that disease, which is the Aedes mosquito, there is potential for movement of some of these diseases into that region. And that's something that should be mitigated from now and avoided, because if we let these diseases establish, it would be very difficult to get rid of them, as had been the experience in some parts of the world like Singapore. So I think I'm going to stop here.
Absolutely. Thank you very much, Professor ElFatih. This essentially highlights the need for further research in the space. This is the extent of what we initially tried to explore, but there's a lot more that we don't know. And while dengue is not a threat today, there might be others that are lurking somewhere in the background that we need to be looking out for and starting to build the right kind of resilience within our own ecosystems for those kinds of emergencies. So without further ado, then Dr. Anna Margarida Costa serves as the head of sustainability at KAUST. And she conducted a brilliant, very extensive bit of research that not yet touches on the implications of climate change necessarily on air pollution. It did to a certain extent, but the topic is just so complex. We barely start to understand the dynamics of air pollution, not only on the international level, but where it really counts on the street level. So Dr. Anna conducted this brilliant bit of research with another colleague at KAUST, Professor Stenchikov, as well as other colleagues from the Max Planck Institute, and kindly remind me of the name of the university.
University of Aveiro.
Aveiro. That's, isn't that your alma mater?
Yes, my alma mater. Yeah.
So please do let us know some of the key findings in your work and what's different or what's really important in terms of areas of focus on anthropogenic air pollution, as well as natural in our region. You know, there's dust particles as well play a large role. So how can we start to understand the dynamics and what combined impact should we start looking out for in the future? So please.
Thank you, Michelle. Want to address them here?
Go ahead.
So good afternoon, everybody. It's a pleasure to be here. As Princess Michelle already mentioned, this is a collaborative study between 3 organizations, and that touches the role of natural and anthropogenic air pollution in the Middle East and its impact on air quality and public health. In the next 2 weeks, we are discussing climate action and effective ways to reduce the world's greenhouse gas emissions. The good news is that by doing so, we are also tackling another major global environmental problem, air pollution. Can you move the slide? Yeah, thank you. Climate change and air pollution are two sides of the same coin. Both are largely caused by the same sources and have similar solutions. Reducing emissions from these sources will help reduce yearly 7 million premature deaths from air pollution. Special attention should be given to sensitive groups of population, children. Air pollution is responsible for more than 500,000 deaths of children every year, mainly from respiratory diseases like asthma. It's also important to emphasize the negative externalities of air pollution. Air pollution has considerable economic impacts, cutting lives short, increasing medical costs, and reducing productivity through working days. Diseases caused by air pollution are responsible for trillions of US dollars in welfare losses each year. The question to ask, why not invest these resources to prevent the problem first place instead of focusing on treating it at a later stage? Climate action to limit emissions reduces air pollution and also its health and economic impact. Can you change slide, please? Air pollution is particularly critical in cities due to geographic concentration of people and economic activities, which results in high emissions from different sources. Today, 55% of world's population live in cities. And this number is expected to increase by 2050, reaching to 68%. City air quality is affected by numerous factors. Transboundary pollution from other regions, atmospheric emissions from natural sources, dust from the deserts, in case of the Middle East, anthropogenic sources, and the major one, road transportation, and also road suspension, industries, residential and service activities, but also from the complexity of the urban morphology, meaning that the way we plan our cities, the way we position our buildings, the volumetry of the buildings, the configuration of the urban space, and the road networks. Can you please change slide? Thank you. In 2019, 99% of the world population was living in place where the World Health Organization air quality guidelines from 2005, and this is important to refer, these levels, these people were living in place where the air quality guidelines were not met. Now, last September, World Health Organization has revised these air quality guidelines and strict the values for PM10 and PM2.5, which means that this already alarming number is going to increase. Can you change slides, please? So Saudi Arabia is the world's 13th largest country by area, but more than 84% of its population live in cities. So our study was a very preliminary study to assess the burden of disease from air pollution in 4 Saudi Arabian cities. And this assessment was done for PM2.5. It is one of the critical pollutants that cause serious health problems. So we did an assessment for Jeddah, Riyadh, Amman, and Mecca using the World Health Organization methodology and using air concentrations, pollutant concentrations for modeling data done from a study from KAUST, from Professor Tensikov, and urban population distribution profiles for these cities. And the critical aspect is that this very preliminary study points out that we have 7,000 annual premature deaths caused by exposure to PM2.5 on these cities. This number is the number exposed for people exposed on this region if the levels were not exceeding the World Health Organization annual value, which is 10 micrograms per cubic meter. Now, having new guidelines for 5 micrograms per cubic meters, but we expect the numbers will increase considerably. So I would like to emphasize this is the accuracy and the completion of these assessments would improve, and this is very important, if we have access to more data, measurable data, concentration data on cities and regions. This is very critical to validate our air quality models, and also to have access to specific concentration response functions and health statistics for the study region. Is this to improve our methodology for health impact assessment? Again, as it was mentioned previously, it's important to complement the health impact assessment with valuation of air pollution externalities to understand the costs of these impacts. Can you please change? So lastly, I want to emphasize that this is not going to get better. So unfortunately, without any action, climate change will make air pollution much worse. And we know that there are critical pollutions that we need to tackle. The short-lived climate pollutants, and those are black carbon, which exists in anthropogenic PM2.5, and also tropospheric ozone. These two components are critical to be addressed. Just the two notes, ozone pollution. This ozone is not the same ozone that exists in the stratosphere. It's a tropospheric ozone. It's the ground level ozone that is formed by chemical reactions with powerful greenhouse gas emissions as methane and the other volatile compounds. And this ozone pollution, when it's mixed with the heat extremes, exacerbates the impacts on human health. So this is critical for the future, specific in cities, as we saw in the Middle East, where the temperatures are going to increase deeply. Another note on PM2.5, and the study shows that we are expecting an increase of 50% of concentrations of PM2.5 if we continue on a business usual scenario. And then the impacts on the Middle East region are even 2.5 an increase on a health consequence of population exposure. So just a final note on the actions that need to happen on the city level. We need to tackle road transportation emissions, and this is critical to tackle the exposure to these harmful pollutants. Of course, reducing the buildings' energy consumption, mainly demanded from AC systems that we need cooling in these areas, but we need to balance this energy consumption from buildings. Again, a shift to clean energy, and again, reducing emissions from managing our own waste in urban areas. And that's it.
Thank you very much, Hannah. I mean, I think the main message, and perhaps will be a message that we'll hear constantly by all of our researchers here, is the need for more data access to more good data in the region, which is quite lacking, and perhaps data sharing between different researchers, but more importantly, more research on the topic, because as you can see, we're barely scratching the surface. This goes back a bit to the intention behind our publication. It wasn't essentially to tell people what the state of affairs are only. Yes, we do know some parts of those elements, but we equally value what we don't know. And those research questions, once put out there, encouraging scientists to look further into our region, but also in areas that we're usually thought of as unvulnerable to. Our region is thought of to be relatively well off and generally thought of as being able to buy itself out of a lot of these issues, but there are some issues that are very difficult to tackle should there be not systematic approach of both on the research front, but equally on the policy front, and sort of the increase of buildup, not only of adapting to a changing climate, but ensuring that we're hedging against a lot of these vulnerabilities. So next, maybe we have on stage Dr. Gregory Sixt, who's a research manager at Jameel Water and Food Systems Lab at MIT. He co-authored, and we're grateful for that piece, Dr. Greg, a piece with Professor Kenneth Stretsberg that essentially looked at the physical climate damages and implications on food security. So not only on the supply chain that exists within the country, but also some implications on trade. So Dr. Greg, you have the floor.
Thank you. Next slide, please. So food security, climate change, and human health are closely linked. Food security is built on 4 pillars: sufficient supply of food, access to sufficient resources and market access to sources of food, healthy diets, and then stability in achieving the 3 previous pillars. Climate change threatens all 4 pillars. Crop yields are projected to decline for all major crops due to extreme weather events and weeds and crop pests. Climate change will also affect livestock and fishery production through diseases and pest, heat stress, and changes in fresh and oceanic systems. Climate change-induced geopolitical instability and infrastructure damage could disrupt global food supply chains, and that's just one example of the map. There is some global trade flows for grains. Nutrient quality of many crops is actually already being impacted by the effects of climate change. That's expected to get worse. And all of these, combined with population and economic growth and associated dietary changes, are projected to drive increases in world market prices. Can't quite see what I've got up there. So these impacts will hit some countries that are currently thought of as food secure. So the GCC is actually one of the most food secure regions in the world. But they have a limited capacity for domestic food production, and they rely heavily on imports to meet demand. So that's the challenge here in the GCC. Next slide, please.
Greg, if it's more helpful, you please feel free to use the podium.
Okay. So my colleague from MIT, J-WAFS, Ken Stresbeck, and I conducted an initial analysis, very preliminary work, looking at the relationship between food security, climate change, and food trade. Our analysis drew upon existing models from the International Food Policy Research Institute, their impact model, and the Global Trade Assistance and Production model from Purdue University. The GCC countries are, as I mentioned, rank among the most food secure countries in the world. Their wealth allows them to bridge their limited capacity for domestic food production with imports and makes them less vulnerable to food price risks than other high food importing countries. However, what we found in our preliminary analysis is that the current food secure situation is masking a long-term fragility. The Council on Foreign Relations reports that countries at the greatest risk for food insecurity are those that rely heavily on food imports, that lack diversity of food suppliers, and that are already facing risks from climate change, conflict, or economic troubles. We've already heard about the impacts of heat and water in the region from some of our other speakers. The GCC meets most of these conditions. Domestic production is capable of meeting very little of local food demands, especially for staple crops, and that's important. The climate change will make it more difficult to grow food in the region due to water stress and temperature. And the GCC are some of the most food import dependent countries in the world. So leaving them vulnerable to food price spikes in the long run. It's also important that map there on the top left, over 1/3 of food imports to the region must transit at least one of 4 maritime choke points. Over 80% of the wheat for the region must pass through at least one choke point, except for Oman. It's 50% for Oman. And some of this risk is lessened a little bit by the UAE's new port on the Gulf of Oman coast, but still it's a challenging situation. Regional instability and geopolitical tensions increase price and supply risk and create the potential for domestic unrest. It's important to note that the populations of the GCC are not universally wealthy. Across the region, the poorest 10% of the population spends about 30 to 50% of their income on food. Immigrants, many of them poor from East and Southeast Asia and other Arab countries, make up a significant percentage of the populations of the GCC. Many don't have access to the social safety nets that citizens do. So the GCC countries' ability to continue to mitigate price risk is dependent also on successful economic diversification away from oil and gas. And the future is yet to be determined on whether those efforts would be successful. So Ken and I developed a preliminary food vulnerability index that indicates risk. This is the large graph on the right, and the part that we should focus on there is the heat map in the lower right there. So this looks at the percentage of food demand for key commodities met by imports and the number of exporting nations that account for the top 80% of their foods. What we find is that for grains, rice, and oilseed, the risk is high or severe for most of the countries. For meat and dairy and processed foods, the risk is either low or medium, but with the caveat being that domestic production of meat and dairy and processed foods is highly reliant on imports for the inputs for those products. So what we've learned so far for the GCC is domestic food production currently can't meet most of the demand for food, and barring dramatic technological revolution in food production, We can expect climate, economic, and dietary changes will make it more difficult to produce food domestically. Absent a new green revolution, yields for most staple crops worldwide are expected to decrease in many of the food exporting nations, I should say. World population, economic growth, and dietary patterns are likely to cause an increase in world market prices. According to IFPRI, it's an average of about 20% by 2050. And as long as the GCC countries continue to have wealth, they should be able to maintain their food security, but that's dependent on economic diversification. One of the ways they can maintain food security is actually by diversifying the number of countries they import from and the regions that they import from. So, even if you're importing, and kind of pulling these numbers out of nowhere, but if a country's importing 86% of their food from 20 countries, that makes them less vulnerable than if they're importing 60% from 2, right? So this is diversifying that, keeping in mind those maritime choke points as well. So this work was a seed project. We're about to launch a bigger project with the International Food Policy Research Institute and other members of the Food and Climate Systems Transformation Alliance. And one of the things that actually the current models don't really focus on is bilateral trade. And we actually know that most food trade occurs between individual countries. So really we need to model that. We also need to model for different climate change scenarios. And we're also going to start, we're going to bring in some nutrition indicators in the future analysis. And that work is going to take about 3 years to complete. So looking forward to the panel discussion. Thank you.
Thank you very much, Dr. Gregory. And now we'll turn to Claire Walsh. Claire Walsh is the Associate Director of Policy at Jamil's Poverty Action Lab, more famously known as JPAL. And we'd love to hear a bit more about your findings and analysis within the global work that you're conducting on poverty reduction, as well as combating climate change and supporting vulnerable communities. Perhaps some of the areas that you've looked into on adaptation and mitigation, and what lessons could we really draw from this seminal work that you've conducted all over the globe that could see some parallels within our region. So Claire, you have the floor.
Thank you, and thank you for the honor to be here today to discuss this important topic. The Abdul Latif Jamil Poverty Action Lab is a global research network working to reduce poverty and combat climate change by ensuring that policy is informed by scientific evidence. We're a network of researchers and research centers at universities who work in close partnership with policymakers to conduct randomized controlled trials that measure the impact of policies on people's lives and on the environment, to help shed light on important questions like, did the policy work? Why or why not? Did it work for some people better than others? And we support policymakers in applying this evidence in their decision-making to scale up effective programs and ensure that policies achieve their end goals and improve people's lives. I lead JPAL's King Climate Action Initiative, our major research and policy fund that works with policymakers around the world to innovate, test, and scale evidence-informed solutions to combat climate change and poverty. And we know that climate change and poverty are two deeply interconnected global crises. Climate change will push an estimated 120 million people into extreme poverty around the world in the next decade alone. And the health effects from increasing extreme heat, extreme weather events, food and water insecurity, and loss of land and livelihood will fall disproportionately on people experiencing poverty, who also emit the least. And so I think it's imperative that policymakers and civil society must start to invest more in climate change adaptation, because we are locked into a certain amount of climate change already, and we need to make sure that the most vulnerable people who will be hit first and hardest are not left behind. So today I want to highlight 3 key factors that policymakers in the GCC and beyond should consider when designing solutions to address the many urgent challenges at the intersection of climate change and health, drawing on evidence from research by JPAL affiliates from around the world. The first key lesson is, do not assume that people or businesses will adopt your technology or practice. Many climate solutions that are gaining excitement from policymakers around the world require people or farmers or businesses to take up a new technology to work. Our research shows that technology alone is often not enough to change behavior. We also need enabling policies, reduce the cost of technology adoption, particularly on low-income communities. So take, for example, climate-smart agriculture, stress-tolerant crops, agroforestry, regenerative agriculture that's meant to improve food and livelihood security, particularly for smallholder farmers. Many of these policies are rolled out without enough attention to their costs on farmers. And more than a decade of research on agricultural technology adoption at JPAL has shown that first, it's crucial to make sure these technologies actually have tangible benefits to farmers within a reasonable time frame. Otherwise, they may abandon it. So for example, in a study we did in Zambia, most farmers abandoned agroforestry a year after taking it up because the trees didn't provide enough benefits to farmers in the first years to offset the high costs of caring for them. So when technologies do take longer, climate smart technologies do take longer to pay off for the people you're trying to get to adopt them, it's important to consider things like removing user fees, providing technologies for free, and even considering providing cash support, credit, or insurance to offset the costs and risks of adopting these new technologies to farmers. So in a study that we did in India, we found that giving away stress-tolerant seeds for free enabled wider spread adoption that in turn increased farmers' yields, profits, and investment in their farms, even during bad weather years, and benefited low-caste farmers the most. So the second key lesson that I want to share today is that protecting health in the face of climate change, it's important to invest in prevention in addition to treatment. And prevention often comes through investment in physical, financial, and social safety net infrastructure in addition to health systems. So one example of a policy that's gaining a lot of popularity in climate change adaptation is something called shock responsive social protection or forecast-based action. And the idea is that if we get cash and other assistance to climate vulnerable households quickly after, or ideally before a crisis strikes, they may be able to take action themselves to avoid illness, hunger, and injury from a climate shock. Now, these types of systems require pre-committed funding, payment infrastructure, and data on where people are and who needs support to be in place before a crisis hits. We saw this a lot during the pandemic, where some countries had this type of infrastructure in place and others didn't. And it's important to start investing in building this infrastructure now. So for instance, there's been a lot of innovation across high, middle, and low-income countries and using technology and novel data sources to identify vulnerable households and get them cash assistance quickly. So for instance, JPAL affiliated professors worked with the government of Togo during the COVID-19 pandemic to use satellite data, mobile phone data to help identify vulnerable households and use mobile money transfers to get them cash assistance within a matter of weeks. There's also been some exciting innovation in microfinance institutions and other financial institutions that are developing climate-related credit and insurance products for low-income households. So for instance, in Zambia, we tested a product that provided farming households with cash and food loans during the hungry season. And we found that these types of products both benefited farmers in increasing their consumption, increasing their wages and yields, and also yielding a 94% repayment rate. So the last lesson I want to share is that we need to reduce other stressors that we've built into our air, water, and land management systems today before the biggest stressor, climate change, compounds them. So for example, in many countries all around the world, water is allocated and priced in ways that incentivize overuse, depleting groundwater reserves, and not encouraging conservation for future generations. So starting to create financial and other incentives for conservation in the water system will be crucial for avoiding massive health consequences from climate change. Another way our systems are currently weak for addressing the challenge at hand is that in most countries, with respect to air pollution and water pollution, there are strong environmental regulations on the books, but very little resources dedicated to enforcement and detection. So work that we've done in India with some of the major pollution control boards shows that just providing regulators with better quality data on pollution levels and violations by firms is a highly effective way to reduce pollution and natural resource depletion. So in closing, I think it's clear from the many health consequences my co-panelists have shared that will come with climate change in the GCC, it's important to start investing in adaptation structure and adaptation infrastructure that does not leave the most vulnerable people behind. And when we provide solutions that are supposed to support communities in coping with climate change, it's our responsibility to ensure that they actually deliver on their promised benefits. And so we need to take care to not make assumptions about how policies or technologies will work in the real world. And it's important to pilot, evaluate them, get feedback from communities about them before scaling them nationwide. And in this way, if we learn while we take action, we have a much better chance of actually achieving our end goal. Thank you.
Thank you very much, Claire. Essentially, a very important reflection on the importance of evidence-based policy and work conducted in the field. So last and definitely not least, we would have wished she was here with us physically, is Dr. Maimoonah Khalil, who's the director of the National Observatory for Women at the Princess Noura University. Dr. Maimoonah has conducted seminal work in the area, particularly a very important index that measures the progress of women in our region. And I think part of our conversations in the lead up to this was that vulnerability of women to climate has never been properly seen or quantified in a lot of these indices. Dr. Anna spoke a bit earlier around the implications of air pollutions and how they hit the most vulnerable, in that case, children. Well, not only in our region, but globally, disproportionately women take care of their children, right? So with it, even indirect sort of implications that women become more vulnerable to. So Dr. Maimoonah, please take us through the paces of why we need to focus on women and perhaps some of the brilliant work that you're conducting at the National Observatory for Women. And beyond that, what needs to exist within how we measure this world to truly, correctly account for women's roles in those indices. So Dr. Maimoonah, you have the floor.
Thank you, Masha'al. I'm pleased to discuss what we know about the impact of climate change on the health of women in general and in Saudi Arabia in particular. Previous global research has found that women are more vulnerable to the effects of climate change than men. Women and children are up to 14 times more likely than men to die in the aftermath of disasters, including extreme weather events like hurricanes, wildfires, and flooding. And those who survive climate-related disasters are more likely to face decreased life expectancy, mental health disorders, gender-based violence, exploitation, and risk of sex trafficking, and increased complications in childbirth. Women's health declines more than male health in times of food shortages. And when it comes to maternal health, and this is just an issue that is of utmost importance, we know that dehydration during pregnancy can especially be devastating to both mother and child. It can affect fetal growth, release labor-inducing hormones, cause preterm birth, and increase the maternal risk of anemia and eclampsia. And although we do not have that threat today, we do know from some of the input that we heard from my co-panelists today on stage that it could happen with the rise in temperatures. We also know that nutrient deficiencies, and that was alluded to today by the fragility of the food supply, these deficiencies caused by food insecurity and undernutrition among pregnant women can affect pregnancy, nursing, newborn outcomes, and lead to low weight births, miscarriages, and perinatal mortality. And there is also the issue of vector-borne diseases, which can affect pregnant women and cause abortions, spontaneous abortion, premature delivery, stillbirth, low weight birth, eclampsia, and cesarean delivery for pregnant women. Now, in crisis-affected countries, there's an even social and health-related aspect to that as well. Child and forced marriage are seen to increase during economic difficulties associated with climate-related shocks. And so girls who become pregnant before the age of 15 are more susceptible to placental tears, obstructions at the time of delivery, maternal mortality, and access to women's health services in general are disrupted after natural disasters, affecting access to contraceptives, maternal and child care, treatments, testing for HIV infections and sexually transmitted infections, which if left untreated can lead to infertility, tubal or ectopic pregnancy, cervical cancer, and perinatal and congenital infections. So in spite of all of these findings that come to us from global research, many countries to this day do not collect comprehensive climate-related, gender disaggregated data. And climate-related, gender disaggregated data needs to be systematically collected and needs to be analyzed in order to make these links more explicit between climate change and health. Now, to come to Saudi Arabia in particular, it seems from the indices that we have worked on at the National Observatory for Women, and even in global indices with the scorecards for Saudi Arabia, it looks like we've almost closed the gender gap when it comes to health. Our score on the women participation, for example, in development index, which is produced by the National Observatory for Women, gives us a 0.98, which is almost a 98% achievement rate in the health sector. And that counts national numbers on life expectancy, birth in adolescence, and healthy births, and birth-related mortality and exercise frequency. However, that number masks the threats I just mentioned and the links between climate change and health. And that is very alarming, since we know from research done on women's health in Saudi Arabia that Saudi women are potentially at greater risk than a decade ago, for example, to develop cardiovascular diseases, diabetes, and there is a problem with increased obesity. We also know that health and social affairs consumes about almost a fifth of the Saudi Arabian government spending, and here we are doing more treatment than prevention, which was alluded to also by one of my panelists. There is the issue, of course, of warming. And how the warming climate of Saudi Arabia is accelerating in recent decades. In one study places it at 0.6 degrees Celsius per decade. And these future temperature projections and these are projected to increase consistently, as we have seen in the first paper, and to levels that are deemed unsuitable for human adaptability. Now, of course, this is going to have an effect on life and health style habits and the country's production abilities of fresh fruits and vegetables, including the nutrients that are needed for everyone, and particularly for mothers and children. So the temperature extremes, of course, are known to adversely impact birth outcomes, the changes in length of gestation, birth weight, stillbirth, and neonatal stress as a result of hot temperature exposures. And pregnant women particularly are susceptible to increasing temperatures and heat waves, since their ability to thermal regulate is compromised. So, although there hadn't been any direct links established robustly and in many studies between climate change and health in the Saudi Arabian context, global research tells us to look out for an increase in preterm birth, a decrease in birth weight, an increase in stillbirth rates, and even after birth, neonates may be susceptible to heat-related morbidity and mortality. And so this is a serious call for action for not only indices to begin including variables and linking those variables and numbers to climate change, but also to diversify and regulate and systematically collect climate data and link that to several aspects of women's health. Thank you very much.
Thank you very much, Dr. Maimoonah. Well, this almost gives you a whirlwind view of the research and a small taste of the research that we have in store. But perhaps this might, with it, give the opportunity for not only questions within the audience that we have here and both at home, but also the opportunity to challenge some of the ideas and the research that we put forth, some questions and areas, maybe gray zones that we haven't really built upon. So please, the floor is right now open. And maybe I'll start with a question that we had on the chat of some of the people who joined us on the Zoom call. And this is addressed to you, Dr. Anna, on what exposure response function have been used to study health impact assessments in the Middle East.
Well, that's a good question. So what we use, and again, this is the work of specific from the University of Aveiro on the city level. On the global level, there was also an assessment for the Middle East that was made by the Max Planck Institute. So I'm not actually the person that developed the specific study. I can tell that there are general functions. And again, this is a critical aspect because we need to develop these functions specifically for the regions that we are addressing. And this is critical. So this is one of the constraints we found. These functions are not available, and the details that needs to be put in place needs to be supported by other data from the health aspect from each country, in this case from Saudi Arabia and other countries we are addressing. So this is basically generally one of the constraints we have in the study. So
okay, fantastic. I forgot to invite the panelists as well to question the findings of one another, since there might be some overlap between some of the areas of research. Again, the idea is to strengthen the output that we have at the end of the day, and an opportunity to give rigor to the exercise that we're all going through. So perhaps I'll give it a second or two if there are any questions in the audiences. And if not, I have a question for you, Professor ElFatih. Okay, Professor ElFatih. In terms of the adaptation measures that have already been sort of applied in the kingdom for Hajj, how do you project the scale up of such measures, and with it perhaps the effectiveness of those types of measures, which include putting out Moya or cooling for Hajjis that go through the different areas or regions within Mecca for Hajj. So Professor ElFatih. You're on mute, Professor. Still on mute.
Yeah. I'm
Okay.
sorry. That's a
No
common mistake. So, I would like first to comment on 2 points made by Shail and Dr. Maimoonah, which is the need for research to bridge the gap between these climate projections and their health impacts in the region. I think that's an urgent need that at some point actually I tried to pursue, and I will try and pursue in the future by reaching out to some of the leading hospitals in the kingdom who are engaged in research about health conditions during Hajj. But there is a need for a larger effort in that direction, and I would be happy to share some of our data and projections with whoever carrying research in that area. Regarding the specific questions about adaptations to Hajj, and you see these pictures that when the Hajj are going for Ramya Jamrat or for standing in Arafat, you see that they are spraying water. Actually, by definition, with the concept of the well bulb temperature, this is not a very effective way of doing things. It's because you are basically adding the humidity, and it's what's causing a problem is the combination of heat and humidity. So in a way, you could be actually increasing the well bulb temperature by doing that. But what we suggested in our paper as potential mitigation measures are mainly non-structural, related to limiting the number of Hajj, number of people who go to Hajj in years in which we project that conditions could be difficult. If you go back to my slides, and I went quickly through my slides, assuming that we'll get the chance to look at them during the questioning. If you go back to the one about Hajj, Hajj is an interesting phenomenon, and for non-Muslims, if you go further, one step or two further, two slides, please. The next one too. You see here there is this cycle of when conditions are really tough, and the cycle is related to the fact that Hajj occurs according to the lunar calendar. And so the day of Hajj moves around the year, and it visits these very hot times of the year during summer. It visits them once and comes back in 30 years. And so you see this cycle every 30 years, the conditions become more severe. And so there is this this cycle that people could use and the projections of the trend that we have from our studies gives you information about the likely conditions during Hajj. So I think non-structural measures through education of the population of Muslims. If I am a Muslim and I would like to perform Hajj, knowing these kind of conditions, maybe I would pick years in which the Hajj would be in less severe conditions. So it may inform your choice of which year you go to Hajj, but it could also inform the authorities' decisions about what number of people would be allowed to perform Hajj in different conditions, in different years. So I think non-structural measures, I'm very impressed by the changes and the structural changes and the improvements and adaptation that have been done by the authorities in Saudi Arabia in like making Hajj more convenient, more space, air conditioning, all kinds of changes that are positive. But I think the nature of the change of the hazards that's going to happen in the future requires maybe additional non-structural changes that would inform people about how safe are the conditions of Hajj in different years. When you look at the past and you see the years in which there have been incidents, actually, and that's the previous slide to this, when we looked at the past, if you could show the previous slide, which just one step back, yeah. You see the years in which actually incidents happened with Hajj coincided with this cycle of observed temperature. So it's when Hajj hits us during summer, that's when more danger happens. So there is room for adaptation, but I would think non-structural measures related to informing the Muslim population and related to also restricting the number of people who could perform Hajj in different years could be effective in reducing this hazard and reducing the risk by making more resilient arrangements for Hajj.
Perfect. Thank you, Professor ElFatih. George, I see you raising your hand. Please.
Yeah, just a question of, well, maybe for all of the panelists.
Get a mic, maybe? Or maybe, yeah.
Yeah, just a question maybe for all of the panelists, which is in each of the approaches that have been outlined, whether it's inhabitability in light of the wet bulb temperature, whether it's pollution, whether it's food security, effective adaptation, impact on health, particularly maternal and child health, what are the closest analog countries or regions to the GCC or specifically Saudi Arabia? And what can we learn from how other countries and other regions are tackling similar problems? Thank you.
Who would love to take that?
I can say something regarding atmospheric pollution.
Go ahead.
I would say that in terms of the GCC area, I think that we are seeing the same pattern in terms of air quality assessment, and there is still a lot of work to be done. This is very clear. So investing in reliable air quality monitoring networks, reporting this data, in making a deeper analysis on the impact of a natural aspect of emissions, specific on the mineral dust, and the difference between anthropogenic pollution. And there needs to be more studies around this, specific in the Middle East. By default, these regions will have a higher impact in terms of specifically on particulate matter. So this analysis is pretty much, I would say that overall in all the region, a necessity in terms of investment.
Actually, I have if you can pull up my slide, it's a second slide of mine that's got the heat map on it. George, actually, I think the GCC is an outlier in regard to our research, especially because it's so uniquely vulnerable to supply chain risks. So if you see, Ken and I left this up because you see the rest of West Asia, which includes other parts of the Middle East, and the heat map just is nowhere near as red and orange as you see for the GCC, and that would be kind of the most parallel region to it. It's the heat, the wet bulb effect, the absolute water scarcity, so less than 500 cubic meters per person per day. I think almost across the region, and the supply chain risks really do make the GCC quite unique in this case.
Anyone else? I saw you smile, Dr. Maimoonah, but I don't know if that was beyond the screen, so not to call you out.
No, I agree. Is the voice okay now?
Oh, maybe Professor Fatah.
As Maimoonah fixes the system there. So I could actually draw parallels to Singapore, a part of the world that I have spent significant time studying and living there too. But in one hand, the Gulf region is an extreme in terms of wet bulb temperature. The hottest wet bulb temperatures ever observed on Earth have been observed around this region. So when we try to show Singaporeans how climate change is going to change conditions there, we use Dubai in summer as an analog. We said Singapore year-round would be like Dubai in summer. And so that gives you like, the other way around. We are using the Gulf region to tell other people about how conditions are going to look into the future. On the other hand, we also, as part of this study, we looked at the issue of vector-borne diseases. And Singapore is a country that has been impacted significantly by dengue. Dengue is a vector-borne disease transmitted by Aedes mosquitoes. And although Singapore had one of the best health systems in the world, and they have been very active in combating dengue, they were not successful in reducing the intensity of the transmission. Actually, the intensity of transmission has been going up. And the lesson we learn from there is that if you let the Aedes mosquito establish itself in any environment, then it's very difficult to fight it. It's extremely difficult to fight it and get rid of it. And so the Gulf region now, it doesn't have the Aedes mosquito. It has a large pool of viruses, in the fact that you have a lot of immigrants from Asia, from different parts of Asia, India and elsewhere, who bring with them the virus in their blood. So if you get mosquitoes establishing in the Gulf area then there is a high probability for transmission of diseases like dengue. And if that establishment happens, it's very hard to fight it. Is the example of Singapore tell us that. So what this is the lesson we have is that it's more effective to try and limit the ability of the mosquitoes to establish themselves in the environment at these early stages. Early stages when the vector is trying to establish, this is the time to be careful and actively prevent the establishment of the vector in the environment, and so prevent the occurrence of the disease, which is one of the risks that could happen under climate change.
Thank you, Professor Fatah. I saw you raise your hand, Dr. Gassim, please.
So Claire, on the work you did, would it be possible to predict the effect of policies ahead of implementing them? I mean, in maybe some sort of modeling for it, and maybe trying really to apply some engineering concepts to a different world, because I mean, eventuality, if it is really there, regardless of how small the scale to start with, if damage is already really kind of happened, then it's maybe too late to kind of predict, although I like the way you have really structured it to start small and then scale it up and go a little bit bigger. Yeah.
Thank you for the excellent question. So I think you're right in that the type of research we do generates results that can inform models to better predict the outcomes of policies. To date, JPAL hasn't compiled that data to try to predict the outcomes of policies. I think predominantly because we have assumptions that as time changes, as context changes, the effects of policies might be different. But there are some researchers, Rachel Meager in particular, who I can share her work with you, who are using the data from RCTs all around the world to try to predict the outcomes of different policies. So I'm happy to share that with you.
We got a comment, and maybe if you wanted to elaborate a bit more, so we didn't give you the opportunity, Dr. Maimoonah, an invitation essentially to collaborate from some researchers in the kingdom who have really looked into the areas of the implications of heat on women's health. But I don't know if you wanted to address that.
Okay, I hope the sound is better now.
Yes, much better.
All right, I'd like to respond to that first question about, a country close by. In our review of all the reports globally, we found that the same call for action and same call for research was made everywhere. And so it seems that that link, because it's so complex and there are so many variables happening with women's health and climate change, they seem to be allusions to a connection, but not a dedicated effort to make that connection explicit. And so I do believe that there is still a lot of work to do on that front. In terms of collaborations, for the second question, that would be wonderful. It is definitely a direction that we're going to take in strides, simply because we work on building indices, and the mandate of the National Observatory for Women is to measure all aspects that affect women's participation in development, and health being a main aspect of their full participation. I think the possibilities are there given the right partnerships, and so I highly encourage them to make connection with us and reach out. And I would love to explore this further.
Fantastic, thank you. Maybe this question that I have for Dr. Greg. What else could we do to add further rigor to the model that has been used in terms of the data inputs that are hyper-regional for the GCC that you used?
So it's a little outside of my area of expertise. Ken's the modeler, but we are working with IFPRI. We're pulling in a team on this. I think one of the key things is looking at multiple climate change scenarios, really starting to dig into the data on bilateral trade between countries, and then starting to look at what indicators of kind of baseline nutrition indicators you could bring in. If Ken were here, I would defer that question to him, but
then I shall email him.
Yes,
with my question. Fantastic. Well, we have one more question for Professor ElFatih. Did you consider any adaptation or mitigation assumptions while projecting heat under these scenarios, as well as a call for the need for more epidemiological studies in the region? So Professor ElFatih.
Yeah, if you show my slides again, we project conditions in the future under two different scenarios. One of them is the RCP 4.5, and the other is the RCP 8.5. So the RCP 8.5, which is the one on your right, this is the business as usual scenario that assumes no mitigation towards the end of the 21st century. The RCP 4.5 is a scenario that assumes significant mitigation. And so you could see how with significant mitigation like the RCP 4.5, you could avoid the conditions around the Gulf hitting this 35 degrees threshold. Still, you get towards very dangerous levels of heat stress, but you do not approach the 35, which we define it as the threshold. So there is gains to be made by adopting mitigation scenarios like what's being now tried as the COP26 efforts to limit the temperature increase to 1.5 and so on. Those kind of measures could help us move towards a world that looks more like what you see in the middle. Significant heat stress, but not really to the level that makes things not suitable for human survival. Another feature of this simulation that I would like to point people's attention to is that when you look at the web temperature, you see that these dangerous conditions are concentrated around the Gulf. Riyadh, the capital of Saudi Arabia, which is located in the middle of the desert, it actually does not suffer much from this heat stress as Dhahran, for example, which is located on the Gulf. So it points to a direction where in the future, some of these cities that are located more inland in the desert region may gain a little bit of advantage because of the dryness, basically, because conditions are relatively dry. So things do not get to dangerous levels of heat stress measured with the web temperature. Of course, the opposite is true if you look at just temperature. The opposite, meaning desert areas would have very high temperatures, but also very dry conditions. And that combination may be less lethal than the humid heat waves. So yes, we consider mitigation, and the results in the middle are the ones that shows what will happen with mitigation.
Noted.
Adaptation, of course, we are assuming that the countries around the Gulf, they have the financial means to basically provide air conditioning that would save people's lives under conditions of very extreme heat waves. However, in general, the tendency toward this warmer condition would impact life on this part of the world, mainly limiting the ability of people to enjoy the outdoors and limit outdoor activity, which is, if we are thinking about health, and that's the topic for this session, climate and health, spending time outdoor in activities, physical activities, is a major preventive health measure for cardiovascular diseases and other diseases that people may care about. So the connection between climate and health is a complex one. And as suggested earlier, further studies are needed to detail some of those connections.
Absolutely. At least not one of them is sort of a focus on the implications of a changing climate on cooling. One of the co-authors on a piece that we authored for the T20, who's not with us, is actually contributing a piece that focuses on the implications on cooling. So when we're talking about cooling, it's not only air conditioning, sort of make it cooler weather, but also cooling of food, cooling of vaccines. So that cold chain, as well in terms of the implications that could be had for it, is hopefully also will be published on in the paper. We saw another question in the audience. Please introduce yourself and raise your question.
Okay. Is that working?
Yes.
Can you hear me?
Perfectly.
My name is Bahaj, and I'm a professor of sustainable energy at the University of Southampton, UK. We have a project in Saudi Arabia. In fact, we have many projects in Saudi Arabia. My question is related to the discussion you had before, which is around cooling. The majority of the amount of energy utilized in cities for cooling is really huge. Yet there is no indication as to how this could be reduced at the local level, and I mean at the city level. So is there a way of thinking about community energy to allow people to work collaboratively, for example, from solar photovoltaics or from solar cooling networks and things like that, to allow you to see that an increasing temperature in the globe could be reduced at the local level in cities where collaboration could occur. And I think this is, for me, one of the most interesting aspects, because 75% of the consumption is in cities, and you need to attack it there.
Yeah, absolutely. And I would add, within our own city, almost 70-75% of electricity use is dedicated to cooling, to ACs. So we couldn't agree more. I won't speak on behalf of the researchers who are not here with us, but there's been a lot of work that's being done and conducted about the potential of deploying district cooling. And like you said, in terms of collaboration of good design and urban planning, I think for a lot of our cities, somewhere down the line, specifically around the 80s, that was forgotten in our history. So the reasons why we had buildings close to one another, the reason why we built our buildings the way that we built them has been forgotten in the process of progress, or so they say. So there's a lot of work that needs to be conducted in that area, as well as potentially the role that geothermal cooling could be playing and could be added to the mix. So there's definitely a lot more research, and we welcome the research that you already conducted in our region, but also further research somewhere down the line. So thank you for that.
I actually wanted to just make a comment real quick.
Please, Greg,
to highlight, Claire hit on something that I think is really important that we often don't talk about, and that's adaptation. Much of the dialogue around climate change, and we were talking about this last night, is around mitigation. And I think some of that's because it's easier, or it seems easier. Adaptation is inherently admitting that we're going to live in a very different world and may lose things we cherish and have to make very difficult decisions. And I think I just want to highlight the fact that you made a really good point on that. And I think that's something that should be absolutely needs to be part of the conversation. Things like cooling, things like building differently so that we come, kind of retro innovation almost. I just wanted to highlight that.
Can I add that on that?
Please.
Another point is human behavior. And the need for using probably temperatures for cooling in your houses that, going to 17 degrees, 16, while probably you have the human comfort to 22. So this plays a lot of difference in terms of energy consumption. So this is a point that needs to change also in the way, we set up our setting points in our AC systems in these countries. It's very often we need to put a lot of clothes to be in these indoor spaces because they are, the temperature is so low. So this is another point that needs to be somehow in terms of education for people to understand that we need to change our behaviors.
Absolutely.
And there has been some interesting work in the US and a few other countries about how to use social norms to decrease household energy consumption. So by showing households how much energy they're consuming compared to their neighbors and whether they're performing better or worse is actually a really cost-effective way to cut energy consumption and might be a potential way to potentially encourage households to cope with a slightly higher temperature that's still comfortable. Yeah.
Yeah.
Also, if I may add one thing.
Go ahead.
If I may add a comment there.
Go ahead, please.
Yeah. So one of the ways in this region that governments are trying to adapt to the changing environment is greening projects that advocate for greening of large areas and adding trees and so on, and as a way to basically cool the temperature, which is actually, if you're focused on the regular temperature, that's exactly the right approach. That with adding trees and adding vegetation, you would cool the temperature. But some of the research we have done in China and now in the US and elsewhere, we have shown that adding green areas actually makes wet bulb temperature conditions worse, because trees do not only make the temperature lower, they make the humidity higher. And the impact of greening on humidity turned out to be more significant than the impact of greening on lowering temperature. So if you combine the humidity aspects and the temperature aspects, you end up with a wet bulb temperature under greener conditions that are worse than what you have without greening. The example that we illustrated this very clearly on is a paper we did for East China. East China, the North China Plain, is an area that has large irrigated areas. It has a large irrigated land, just like the Midwest of the US. In there, the fact that irrigation is practiced over large areas, we have shown that that factor results in making the wet bulb temperature conditions even higher than otherwise. And so while it's really something that to be applauded, the efforts to green the region and all that, we have to be careful when we think of that and in relation to heat stress, because we may achieve opposite effects than what's being intended.
Yeah, so maybe if greening, then the right kind of greening, one that is not adding to the humidity factor.
Can I add something on this? And another point on air pollution, which is critical. Perhaps people don't know, but greening means that we will emit biogenic emissions, which will be organic volatile compounds. And this has trigger effect when we mix up with the tropogenic emissions from road traffic, for example. So we mix it with NOx and we have tropospheric ozone, and this is what we don't want. So when we green, we need to also be aware of this fact. So we need to green and remove some of the anthropogenic sources for many reasons, because they will add another effect, harmful effect to the problem. So this is a critical point. And future, previous work that was done actually to understand that some of this greening in urban areas can actually trap some of the pollutants when we use kind of trees that doesn't allow proper recirculation of air and street level. So this is something that also needs to be addressed.
Yeah, and I think
so again, I think building on what comments that were said earlier, this is another area where research is needed. There is need for research to understand what are the intended and the unintended impacts of greening projects that could be introduced in the region.
Absolutely, and I think the type of greening as well. There has been deployment of greening projects, let's say on highways sometimes with the right kind of crops. Those tend to have the opposite effect of where it helps scrub almost act as scrubbers for the air that's passing through them from the pollution that vehicles are emitting. So it requires careful consideration, but also how do we water said plants? I think at least for our generation, it brings with it a lot of exciting issues to solve for. So maybe not the old ones, but new ones. And with it, again, maybe a lasting message for the need for aggregating and sharing open sourced data on these issues that's of extreme importance. And I think everyone on our panels highlighted today the need for more research. So like we said, this is meant to show us more of what we don't know than what we do know. And hopefully we've succeeded with our panel. So I'd like to extend a warm thanks to all of our panelists and their contributions. And we look forward to hopefully releasing our report Q1 of 2022. And with it, multitudes of discussions and debates and digging into all of the nitty-gritties of whatever we're proposing and we're putting into text in our paper. So thank you all for tuning in, and thank you all for staying with us so late, both at home, if you're in the kingdom, and